each woman is different. If they're thinking of getting bioidentical hormones, they really need to go and get checked out, because it's not one standard
No.
prescription that's going to take care of everybody, isn't it?
No, it's not. And how women absorb and metabolize is very different. So you can give, in my book I have this chart of giving the same amount of estradiol to women, and some women absorb just a little bit and some women absorbed a lot, and it's the exact same dose. So how women absorb is very, very different too. So it's very good to start out very slow, very, very slow. And the women that I do, I work with women on a consulting basis and work with them to get started, and then as they go through changing their hormone formulation or their dosage to get to what's right for them. I start them out very low, and they get very kind of frustrated the first few months, 3 to 4 months. But then when I talked to them, I was just over, because I set several women up like this in Hawaii a year ago, and when I just saw them again, they just were so excited. Thank you so much. I feel great. You've saved my life, and you were totally right. And so that's how it needs to happen, is to slowly build up so that you determine exactly what that woman needs and how she's going to absorb. So, and the other thing is that women's ovaries keep producing testosterone. And this is something that's not really recognized still. And the amount she still produces is very variable, just like men at midlife. Some men still produce a lot, and some men start in dwindling down. And that's the same with women's ovaries. So there's also looking at the symptoms of, is she going to need testosterone or not?
Well, you talked about some of your patients feeling so good afterwards. In what ways? What are the differences between getting the correct amount and not doing anything? What within their body? What do they feel? What are some of the more common symptoms, I guess?
They feel like themselves. Literally, it's getting them to what their body's been used to their whole life, so they don't have aches and pains and problems. But they just feel good. They feel they have enough energy to get through the day, and they're emotionally happy. They're not depressed, and they're not having problems with their bladder and incontinence, because that can start happening for some women at menopause. And every time I walk down the Depends aisle in the store, I just want to say, women, get your hormones. So, because those tissues down there are very dependent on the estradiol, the hormone we lose at menopause, and very dependent on testosterone. And so when women lose those two, they start becoming incontinent, and that's a huge, huge problem today.